Hi, I'm Lahiri Nanda and this is Hustling from Home. Today we'll be looking at how the healthcare industry has adapted itself by moving some functions online. For this, we'll be looking specifically at onco.com, an online aggregator of the healthcare industry that has its focus on cancer. Cancer specifically requires often in person consultations, but Onco.com has revolutionized this concept by moving consultations online, also advice and prescription sessions. For this, I have with me today Ms. Rashie Jain, who is the co founder of Onco.com. Thank you for joining us, Rashie. So let's begin. Tell me a little bit about the fiscal impact that COVID-19 and its resulting lockdown in India have had on India's healthcare industry.
So, the COVID-19 outbreak has impacted the healthcare industry in unique ways globally, including in India. If you start with the healthcare delivery sector, which is the hospital industry in the country, it has obviously come under a lot of pressure now on the supply side. Fortunately for India, the reported cases of COVID 19 are still not as high. And because of that, we have been able to handle the disease burden effectively so far. But having said that, a bunch of hospitals are now only catering to infectious cases, thereby impacting the care of patients who have chronic diseases such as cancer and diabetes. And that gap in care for chronic disease segment is going to increase this disease burden in the subsequent quarters, which will have negative ramifications for the overall healthcare industry. We are already seeing a lot of hospitals only catering to emergency cases for such diseases and otherwise being open for infectious diseases only. We are also seeing a lot of government centers only focusing on taking care of COVID 19 cases, which is going to make the care delivery of patients with chronic diseases, patients with cancer, more affected. Another segment in the healthcare industry that is negatively hit is the medical tourism industry. India is a global hub for medical tourism, and because of stop and travel of international patients, that segment is going to get impacted badly and is going to have negative ramifications for the overall healthcare sector. But there have been some pretty monumental positive developments as well in the field of telemedicine. MOHW, in collaboration with Niti Aayog, came up with detailed guidelines on telemedicine. And for the first time in the history of healthcare sector in India, at least, we are seeing such a wider adoption of teleconsultation services. We are seeing a wider acceptance among the physician community to go on these platforms and offer virtual teleconsultations to patients. We are also seeing patients becoming very comfortable with first consulting with doctors online before going ahead with their treatment. And I think this is a sticky adoption. This is going to stay even after the lockdown ends. And so it's a very positive impact for the digital health sector overall. And I think that's definitely going to have positive ramifications for the overall healthcare industry and change the way the care is delivered in the future. I also feel that we'll see a lot of internalization of supply chain with regards to medical equipment and pharmaceutical drugs in the coming future. So overall, I think the impact of COVID-19 outbreak has had unique consequences, some positive and some negative developments that will transform the way healthcare is delivered in months to come.
So, all of your company's functions that involve interaction with patients are located online. So, what does working from home look like for your employees?
So around mid-March, we foresaw that a lockdown is inevitable and we took measures to go work from home. So this was before the formal lockdown was announced by the Prime Minister. And we did that because we really cared for the safety of our employees, and we knew that the best strategy to ensure that everyone's safe and everyone's productive is to go work from home. So we implemented this on the 15th of March. And so far, we've done well. We've survived. We've not seen any drop in our productivity working from home. We have taken a lot of measures to ensure that the team remains connected even while working remotely. We are all using Slack, we are connected on various remote working tools. And the key here is that communication has to remain a constant no matter how many diverse teams you're working with. There has to be a standardized protocol that needs to be followed in ensuring that that communication channel doesn't break. And so before we went work from home, we created specific protocols and guidelines around what one needs to do to ensure that everyone is aware and there is enough transparency around the projects that are currently undergoing and the launch dates and the timelines and all of that. We also encourage our team members to send a daily update to their managers on the tasks accomplished, the initiatives taken, the projects they're working on. And we also have implemented simple measures like ensuring that after every meeting, minutes of the meeting are shared. All these things allow everyone to stay connected as well as creates a sense of discipline, ensuring that the information is not lost because we're working remotely.
So, one of the industries that first realized the ramifications that came with this pandemic was definitely the healthcare industry. So, tell me a little bit about how your company prepared for the pandemic and how it's doing now that the pandemic is on in full force throughout the country.
So, these are unprecedented times for anyone in the healthcare industry right now. And I also think that the patient now has a new normal. It is not easy to just walk into a hospital and get a consultation. And obviously, there is a state of panic among patients with chronic diseases such as cancer. And over the last few weeks, we have taken a bunch of initiatives to serve our customers better. Just for context, Onco.com is a digital health company, and we are focused on providing the right treatment advice and care to cancer patients and their families. And in the last few weeks, we launched a number of initiatives, online initiatives specifically, to help serve our customers better. The first one is a teleconsultation service. It's called Call Onco. And anyone who chooses the service gets connected to an oncologist who specializes in their type of cancer. And patients can get a 20 to 25-minute telephonic consultation from the comfort of their home. Oncologists answer all types of questions around the treatment, around the side effects, any kinds of specific aspects of the disease, as well as precautions they can take around COVID-19. And the other thing that we've done is we've realized that a lot of patients are now finding it difficult to continue their care because a bunch of hospitals out there are now not accepting new cancer patient cases. So second initiative that we took was to work together with our hospital partners to identify a list of restricted partners that are out there that are still treating cancer patients and make this directory available to our cancer patients. So anyone who comes to Onco can get advice on which is the nearest hospital to them that is still open where they can get treated for their cancer. And this has really helped them get a more coordinated care at the hospital center as well. We arrange for travel. We arrange for an online opinion before they travel. We do priority appointments, and that's really helped a lot of our patients. We are also focused on creating a lot of content through our partner doctors, and to that effect, we have launched a webinar series where oncologists will come and talk about different aspects of cancers, different types of cancers, and treatment protocols that are available. We'll continue doing so, and we'll produce more and more content because we are aware that a lot of patients and their families are now online and trying to find as much advice and information as they can, and we'll do our bit.
I think those are definitely some concrete steps you've taken. And finally, what advice do you have for the healthcare industry, professionals specifically in the healthcare industry at this time?
So these are unprecedented times that we are facing, and this is going to impact everyone, every professional, especially so startups. And for founders out there, my advice would be to have a two-pronged strategy to sort of do the best in this crisis. I think the first aspect is to focus on cost containment. you have to ensure that you are optimizing on your costs. Vanity projects should be shut down. You should really go focus on your core services. Try to focus on the maximum ROI that you can get from um, any investment that you're making, whether it's on the marketing spend or on hiring new employees. But really, have to be very, very tight on your budget planning right now, because the fundraising cycles are going to get impacted, unfortunately. And the strategy should be to survive this tide and come out stronger. On the other hand, I would say that if you are in the healthcare industry right now, you should know that your customers need you now more than ever before. And so you need to ensure that you are agile enough to launch services that can cater to your customers' new normal. Patients' normal has changed, and they might be willing to use your services in many different formats that they wouldn't have in the past. So make sure that you're agile, you can launch new product lines in time, you can be out there to serve your customers and create a good experience for them, create an experience that allows them to value you in these times. And that can ensure steady growth even in these difficult times. So my advice to professionals out there is that make the most of the challenge that is thrown at you, and maybe for all you know, when all this passes, we emerge stronger as a professional community, and we have new learnings that we otherwise wouldn't have had. So now is the time to become a wartime founder and go out there and hopefully dominate. Nice.
All right, well, thank you so much for that advice, Rashie, and thank you so much for joining us. And to all of our healthcare professionals out there, thank you so much for keeping all of us safe and for advising us wisely at all times. And to everyone else, stay safe, stay informed, and keep hustling.